economy and we focus on the poor rather than on the marketplace. And we are, just to give you an idea, this book exemplifies what Sister Simone has shared with us this morning. And just so that you know that I got this from her, she autographed it. She says, "Keep on agitating." What a great message. So, thank you for wanting to make sure that the most vulnerable are taken care of. They're too often overlooked. They're an afterthought. And for motivating us to do that. Now it's just really a high honor to introduce a couple celebrities. I watch 60 Minutes occasionally when I walk in the family room, do my walking. And the 60 Minutes fame, we have with us Teresa Gardner, who is the director of the Health Wagon from Wise County, and Paula Mead. We are amazed at their tenacity. Both are trained medical professionals, and they are the difference between life and death on the road, giving care where there is little hope. I remember one scene from 60 Minutes where Scott Pelley says to these two lovely women, he says, "I understand this health wagon is pretty rickety, it's seen its better days." And one of you turned to him and said, "Yes, there's a hole in the floor." And he says, "Where?" And she says, "Right next to your feet." So you know I got a lot out of that program. Anyway, that motivated us to invite them. And I think as we hear from them, we should consider that of all the forms of inequality, injustice in the healthcare system is the most shocking and inhumane. Martin Luther King. Right? We've had technical difficulties. My experience is that if it can go wrong, it will, but I hope it's working, and it's all yours.
Thank you for having us. It's wonderful. It's really hard to follow Sister Simone. And I was jotting down notes because I'm going to use a lot of her material. But as he said, I'm Dr. Teresa Gardner, Dr. Paula Mead. I'm the Executive Director of the Health Wagon, and Paula is our Clinical Director. And we're going to do a brief PowerPoint, and then we're going to show the 60 Minutes piece. And we're so thankful to be here. But at this point, I want to turn it over to Paula. She's going to do the first part, and I'll pick up with a very special project that we do.
Thank you again for having us. And we started out, this is a picture of our beautiful mountains in Southwest Virginia, if you haven't been down there. And we were very thrilled to have just gotten our new bus. We had it wrapped, and we had it wrapped with our mountains. So it's a plastic wrap with the beautiful scenery of our mountains. And we're very proud because I was the one that almost fell through the floor when we realized that the only thing holding me up was carpet. Our mission at the Health Wagon is to provide compassionate, quality health care to the medically underserved and the vulnerable population in the Appalachian Mountains. We were founded in 1980 by a Catholic nun, Sister Bernie Kinney. Sister Kinney came from Massachusetts with her Boston twang and fit right into our mountains. As you can see, my twang is a little different than the rest of everyone else's group. She had flaming red hair and began delivering health care out of the back of a Volkswagen Beetle. That's how we got the name, the Health Wagon. We say she had innovative model health care because she did this on her own. She had no government assistance, but she took the care to the people because that's where her heart was. Since then, we have grown. Teresa has been with the Health Wagon for 23 years now. She started off the back of Sister Bernie's porch. So you can see this started at a very low level. God has blessed us, and we continue to grow. And we just wish that everyone could look down and have the heart and compassion that motivated Sister Bernie Kinney. She was sent here by the Richmond Diocese back in 1980, but she stayed and made it her mission to take care of those in the mountains. And If you know anything about our culture, we're very isolated, very suspicious kind of culture there. And she just fit right in. She's part of her, she's an icon. And everywhere we go, people still ask about her. She still volunteers at our RAM event. I'm not going to bore you, but here's some of the health outcome ranks. If you look, you're on the edge with the big old lines there, are our counties: Wise, Dixon, Russell, and Buchanan. When you're looking here at Fairfax and Arlington, and Fairfax County is one of the richest in the nation, Buchanan County is the poorest in the nation, and we all say that Virginia stops at Roanoke. The death rates are much higher in our service area than Virginia overall. If you look, one thing that at the bottom line, 72% are more likely to commit suicide. That really, when I found that statistics, it was heartbreaking, and it put chills on me because I'm like, there is something broken. 72%, that's incredible. And that's the statistics I want you to get out of that. We are now comprised of 2 mobile units and 2 stationary clinics. We travel into the mountains. We go to 10 different sites. Our services are totally free of charge. We do ask that patients will donate a $10 fee for administrative care. And we found when we first started doing that, because Sister Bernie was totally free, Teresa and I was like, well, I don't know if we want to do that or not. But actually, the patients feel like they're able to give something back. They've always given back in quilts and jellies and jams and food and feeding us, but this is a way they also buy into their healthcare system. We feel like we are actually a healthcare model that can be taken across the nation. We provide care with nurse practitioners. We have a total of 5 nurse practitioners now. Teresa and I are the only 2 full-time nurse practitioners. We provide care using generic medications, $4 list, and we do minimal labs. We have a discount and available through a national lab company, LabCorp, who provides those labs free of care to our patients. And actually, when patients get to us, I had a nurse practitioner that just started working for us, and she's like, oh my goodness, I've never seen patients like this before. They wait until they are so sick because they don't have the advantage of saying, okay, my eyes are getting bad or something's wrong, I just don't feel good. They wait until something is catastrophically wrong, until their organs are already failing, and that's what we end up with. In 2013, we had 215 clinics. The number of active patients that we have is now 4,200. We had 7,400 patient encounters and telemedicine consults. We do more telemedicine with the University of Virginia than any other clinic. What I want you to notice about this is our 4,000 patients that we have been struck with a devastating economical situation because we're coal mining there. And we have picked up in 2012, we had 2,000 patients. We are now up to over 4,000. The patients that we're seeing now, in contrast to the ones that maybe have been working at McDonald's, had lower paying jobs, they are now patients that were working in the coal mining industry, always had good jobs, had good insurance, and we've been totally wiped out. Right now there are only 500 coal miners in Wise, and that's the lowest number ever, and that's in the whole county. So we have picked up over double. Our healthcare outreaches, we do everything. We do acute disease management, chronic disease management. We try to help them get their medications by ordering through the Pharmacy Connect program, which is a state-sponsored program. We also do a lot of telemedicine, and this is with UVA. Teresa and I recently went to the University of Virginia. We were trained to do colposcopies. This allows us, with the help of Dr. Peyton Taylor, over a television screen, he can actually see a woman's cervix, do a biopsy, and if they have an abnormal pap smear, it can be treated right then and there. This is so important because we actually have Teresa's family member who died at 26 of cervical cancer. For those of you that may not know or in healthcare or not in healthcare, no one should die of cervical cancer. It's all about prevention and able to get a pap smear. What happened was Stephanie actually went to and had a pap smear when she was 18. It was abnormal. She didn't have any healthcare insurance. She didn't know what to do. She didn't go back for follow-up because she was scared. She was 18 and she was young. By the time she was in her mid-20s, she was in severe pain, went into the ER, and was found to have metastatic cervical cancer, and she died probably 18 months later. At her funeral, her father stood and said, no one should have to sit and beg for their daughter to die because she suffered so greatly.